Good afternoon and welcome to the Western Sydney Local Health District Annual Western Sydney Health Forum for 2022. My name is Justin Hill, Australian entertainment reporter, and we're coming to you today from Westmead Hospital. I'd like to begin by acknowledging the traditional owners of the land on which we meet, the Burrumardigal people of the Darug Nation, and pay our respect to elders past, present and emerging. This always was and always will be Aboriginal land. This annual health forum is an opportunity for the Western Sydney community to take a look at what's been achieved in 2022, gather insight into where the district is headed into the next year and beyond, and ask questions of the district and its services. We put a call out to staff and to the public to submit their questions in the lead up to today. Thank you so much for your participation and thank you for joining us virtually today. Here with me in the room today we have Chief Executive Graham Loy, General Manager of Integrated and Community Health Jasmine Ellis, Director Nursing and Midwifery and Clinical Governance Maria Lingham, and joining us will be Acting District Director Aboriginal Health Strategy Belinda Cashman. Now for those of you watching at home, please feel free to ask any questions that you might have today. You can use the comment box below the video throughout the forum. And if we're unable to get to your question today, someone from the Health District will respond to you following the forum. I'd now like to introduce a video message from the Deputy Chair of the Western Sydney Local Health District Board, Loretta Demento.
Sydney Local Health District, let me warmly welcome you to our annual meeting. Western Sydney is a vibrant community. Over 2 million people call it home, and we are a showcase for multiculturalism with some of the highest levels of diversity in New South Wales. The recent census shows us that we are a young population and increasingly highly skilled. So when you combine all of that talent with the many cultures, many languages, and all of the innovation and new ideas that brings, it makes for an exciting environment for us to work. Our focus as a health district is to help the people of Western Sydney communities live well, stay well, and manage their health well. And all of our successes come down to the extraordinary staff who day in and day out have patient care at the centre of all they do. Our board has been monitoring the progress and achievements for the year, and we've been really impressed by everything that's been accomplished, considering of course it has again been a challenging year. From a financial perspective, we operated within our budget and had total expenses this year of $2.4 billion for the 12 months to June. Of that total, 60% relates to employee expenses, and as the backstay of our service provision, it is an important investment we make each year. The board and I are excited about the future, about the partnerships that are formed, and about all the opportunities that are coming through new models of care. All of this is part of the ongoing support that we'll provide for the healthcare needs of the people of Western Sydney. And finally, can I say some thank yous for those that have organised today, and also to all of you that have made a contribution to the district for this year. Thank you.
Thank you so much for that, Loretta. Now to get us started today, I would like to welcome Chief Executive of Western Sydney Local Health District, Graham Loy, to share a few words.
Hi, thanks very much for opening up the event for us and for working with us today. It's a really big day for us in the calendar year, and it's really important that we get to share the event with everyone, and the ability to actually communicate what we've achieved during the year and the amazing things that have occurred is fantastic. Can I also start by acknowledging the traditional owners of the lands on which we meet. We are on the lands of the Burrumardigal people of the Darug Nation, and pay my respects to elders past, present and emerging, recognising Belinda, who's in the room with us here today, and everyone else who's watching us online. Was, is and always will be Aboriginal lands, and it's a really critical part of our culture that we acknowledge and recognise our history and where we come from and how we can add to that culture in the future in a harmonious community. Gee, what a year 22 has been for us, 21, 22. It was huge. If I think back to where we came from, who would have thought that I would have spent the last 2 years managing a pandemic? Who would have thought that we had to be as agile and innovative as we were? And yet every day our amazing staff stood up and came to work, helping the community, helping each other, and looking at ways around how we can really make the place better. We had some huge challenges for vaccinating people, for keeping people safe, for treating them with COVID. And we really had to redesign our system to sort of manage that. We needed to think, how do we do it differently? How do we get people in their homes and get them care closer to where they need to be? How do we adopt technology and be virtual in the way that we do things? Like we are today, a virtual annual public meeting, we were virtual all the way through, and that really accelerated through the course of not just for our staff, but for our patients. Services like our In Touch service that really were amazing, stood up out of some ideas and some thoughts around what we'd had. Jasmine's here tonight, some amazing leaders in that service that really said, yes, we can do this and let's do it differently. And I think we're just fantastic in how we came together. I'm so proud of some of those things that we could achieve in that space and what we could do with the communities and keep them in their home. It was really important. Things like Kudos Bankarina, the mass vaccination centre, oh my God, that was a phenomenal effort. 360,000 people vaccinated in about 13 weeks. We put the whole thing together in just 12 days. And really, when I think about what we achieved in that space, after I got over the initial, cardiac arrest for being asked to do it at that speed, which was really quite a daunting task, to see the whole system stand up and to see all of our leaders and all of our clinicians come together, it was just a phenomenal effort. It hasn't just been about COVID though, we've done so much more. We've opened up a new paediatrics unit at Blacktown. We've opened up a new mental health unit at Blacktown, purpose-built state-of-the-art centres that provide contemporary best practice care that we can for our mental health patients. It was really nice to see the addition of paediatrics into Blacktown. It's been a gap that we've sort of relied more heavily on the Children's Network for, but now that we can provide those purpose-built in-house services, it's just another fantastic addition to the community of Blacktown. We are still doing lots and lots of planning. We're talking about Rouse Hill and what we can do in that space. We're well into the planning phase of what we're doing there, so that is progressing really, really well. It's going to be an exciting opportunity to showcase what hospitals of the future should look like and how contemporary care can evolve from what we've learned, not just through the pandemic, but over the decades of healthcare and what we need to do moving forward. So that's phenomenal. We have a new mental health building that's being constructed that we're in the middle of the planning phase for at Westmead, which is the transition of Cumberland. Again, that'll be a super exciting opportunity for us to showcase what we can do. The way that we connect into country in that space, the way that we look at models of care, we co-design with consumers, we look at all of that sort of space around how to make our care better, how to make the patient experience better, how to think differently around making sure that when we are treating our consumers, it's not just about their illness, it's about them, it's about holistically about what they need, it's about their family, it's about their carers, and it's about our staff and how we deliver that, because without the most committed and dedicated staff that we have, we would never be able to provide the amazing care that we do. I mean, I'm enormously proud of what we've achieved in the last 12 months. I think we couldn't have done better. When I look at the breadth of everyone, the effort, the commitment was just phenomenal. But we also have to add in research. So we haven't just been getting through a pandemic and building. We've actually been studying and planning for the future. So the amount of research that we've done all the way through that process was huge. It informed our models of care for community, for In Touch, for our COVID response. And it was just fantastic to see clinicians coming together at pace, looking at international communities around what can happen, looking at what we're seeing on the front line and what our staff and our patients were going through, and studying that and turning that from an academic sense into a model of care and how we can move forward as well. So really from the full breadth of managing a disaster, managing a healthcare facility, trying to manage expectations and keep people safe. I couldn't be prouder of what we have all achieved. It's an amazing team. The staff are phenomenal, and I just look forward to 2023 where we can play catch up on some of those people that we've had to put off a little bit because of the pandemic, and also really launch us into the future. So welcome to today, everyone, and thanks for coming along.
Yeah, incredible work. Thank you, Graham. Now, before we start our panel discussion today, let's take a moment to reflect on the year that was. This video is a snapshot of the district highlights and achievements from this year.
We've had quite a few people that have come through to get their vaccination. and I think it's been very well received.
They've survived a war. Now Australia is making sure Ukrainian refugees who've made their way here are armed against COVID.
And we're here at Westmead Hospital in one of the wards, and we're going to go meet one of the patients here.
And this is a special medicine for us.
40 years on, the anniversary was celebrated with cake and birthday cards. The present, an Aboriginal art mural painted outside the entrance.
Happy birthday to you. Hooray!
Thank you all very much. That's lovely. Thank you.
Families in Western Sydney can now access high-quality care for their children closer to home with the opening of the new paediatric ward at Blacktown Hospital.
Those who lived experience mental illness were involved from the very beginning in this project. They really reshaped the way that we made this unit and redefined it.
Atrial fibrillation is the most common cardiovascular complication after major surgery. This grant will enable us to address the question of how do we reduce stroke in patients with atrial fibrillation after surgery.
We're testing a drug called bevacizumab, which has been shown to be active in many other disease settings. So we want to use it in conjunction with the existing treatment of combination immunotherapy.
Australian scientists are conducting cutting-edge research to overcome the worldwide shortage of available organs.
Western Sydney Diabetes has set up an interactive display in Blacktown to educate people about the types of food that can lead to diabetes.
Dr. Smita Shah is the community physician at Westmead Hospital. Her career has been devoted to education and developing preventative medicine, all aimed at improving health in culturally diverse and disadvantaged communities.
We've been really innovative with this Code Black project, and we've managed to incorporate virtual reality as part of the program.
It's actually super realistic. I actually felt like I was in the ward.
This story is about 4 generations of Gumbaynggirr women. It is about my mother, my grandmother, my great-grandmother, and me.
The round blankets have become my signature blanket.
What are people and patients' reactions when they see your unique matching cap and shirt?
The patients really quite get a nice lift out of and surprised by seeing somebody dressed in the colourful scrubs. So.
Wow, what an incredible year it has been so far. Now it's time to kick off our panel discussion with Graham, Jasmine, Maria and Belinda, who will answer the submitted questions and hopefully provide some greater insight into the year that was and where we're heading. All right, we'll get into our first question for you, Graham. Now, it's about the long-awaited capital works project at the top of everyone's mind, Rouse Hill. The question is, there's been a lot of political talk about hospital funding and new hospital developments and upgrades. Where is Rouse Hill Hospital development up to, and what new services can we expect?
Oh, well, I mean, Rouse Hill for me is one of the most exciting projects that I've got on at the moment, not just because it's a new project that the communities of the Hills District really need, and it's, you know, we've sort of been working our way through developing it, but because what it means for the community. So we are actually, we've been on this journey for it around what does a hospital of the future look like. So we kind of have wavered away from the discussion, how do you build a traditional hospital, which would really say, what's the population look like, what do we think the services will be, you know, add in your grandmother's age, multiply by 3. I'm being a bit facetious, but you know, have a bit of science around building it in the old-fashioned way. What we've done in this model is to say, let's think of it as a research project rather than a capital project. So what does the international best practice say? So what can the community expect? They can expect a state-of-the-art hospital that is built on international best practice. 120,000 peer review articles we were looking at, about 20,000 of them came from within Australia. We did a whole heap of work with the community, and we surveyed a whole heap of community around what do they expect and what do they need. We looked at the burden of disease that's in the Hills area, so what is the most prevalent reason people go to hospital at the moment? And then we built backwards from there, and then we added in the population data to say what is the size of it rather than what is the design originally. So it really gave our clinicians the opportunity to think freely around and get excited about what does a hospital of the future look like. And it's not just in the clinical services, so it's reaching outside the walls of the hospital, so it will have a really strong connectivity with the community. We partner with the primary care, so the old days of GPs down the road and the hospital on the other corner of the suburb, you know, we're moving past those, and we're sort of saying GP on site with us, a true partnership model, how we work together. So, you know, from primary care all the way through to acute care, the citizens of the Hills District will be able to get, you know, good access all the way through. Lots of really exciting stuff. So it's you know, I'm expecting announcements soon where that will come through. That's up to government to make those decisions and make those announcements. But you know, it's all really exciting about what's coming through. I think what the people of the Hills District can see will be a really state-of-the-art contemporary model that will give them good access, which is designed around them rather than designed around our system, which is really important. Embraces the ambulance service, embraces community, embraces primary care, and puts in those services that we really need there, but then makes it connect in as part of a greater network as well. You know, we are a district and we have some enormous strengths around the place, so the better we can connect them in, the better the care that we'll be able to provide for the citizens.
Yeah, it sounds like a very multifaceted approach, which is awesome. I can't wait to hear a little bit more about it very soon, hopefully. Yep, fingers crossed. All right, a topic that has prominently featured in news bulletins across the state this year is nursing strikes and rallies, which brings me to my second question. This one is for Maria. Nurses across the district have raised concerns about the lack of staffing in several departments that have held rallies across some Western Sydney local health district facilities. Earlier this month, midwives at Auburn Hospital rallied on their meal break regarding this issue. What is in place to help better support the nurses of the district moving forward?
So just to start off with, I'd like to acknowledge our nurses and our midwives across the district. They've been an absolute incredible cohort of staff, and I'm incredibly honoured to be part of them. The last 2 years they've been the backbone of everything that we've done in terms of COVID, and they've just been amazing. So I want to start off with that, and yes, it has been an incredible couple of years, and we do have an exhausted workforce, but with that comes some incredible work that we've delivered on, including some of the services that Graham has spoken about. I think we have had COVID and we have had the flu as well this year, and we have had staff furloughed, and so it has impacted on some of our services, etc. But what we do have is a lot of work that's been done in the background. So if we look at the last 10 years, we've actually increased by about 24%, which is over 2,100 staff members in the last 10 years. Over 1,000 of those have been nursing. So we are enhancing. Just in the last year, we've had 335 FTE enhancements, and of those, we've been looking at our critical care services, and we've increased 20 FTE in the Blacktown Mount Druitt Emergency Department, another 30 in Westmead Emergency Department, and another 10 FTE in the ICU. So we are really focusing on our really impacted workforce around that. Moving forward though, we also need to look at our workforce in relation to the vacancies that we've got, and what we're doing is really focusing and developing our own workforce and growing our own amazing nurses and midwives. And so we've committed to, and we've actually recruited to 500 new grads that will be starting next year, and that is the highest in the state. So we've really spearheading that piece of work. Together with that, we also are working closely with the universities and increasing our clinical placement numbers, particularly around our midwifery staffing, which will enhance and hopefully will become the workplace of choice for our midwifery staffing. And we've increased that by 50%. So we're really excited about that as well. In terms of Auburn, we've already started recruiting, and yes, there has been a bit of a gap there, but we're closing the gap. We've already recruited close to 6 FTE, and we're continuously recruiting that. Our nursing and midwifery executive is working quite closely with the staff in maternity services, and we're keeping them up to date in relation to where we're up to. So very, very exciting times for nursing and midwifery services, and I think this time next year we'll be in a very different space and a very exciting space where we'll be building culture around nursing and midwifery.
That's fantastic. That's very good news to hear. Now on to our next question. Today more than ever, especially following the COVID-19 pandemic, a huge spotlight has been put on mental health and the services in place to support the community. So question 3 is, what additional services will the districts be adding to support mental health into the future? Graham.
Yeah, really good question, Justin. I think, first of all, the B22 that opened up at Blacktown was huge. That was a really brand new state-of-the-art facility we relocated what was a really outdated model, to be perfectly honest, into a purpose-built facility. We are now heavily into the planning phase of the new mental health building. That's the $460 million building, which is the relocation of Cumberland. There's a huge amount of planning work that goes on the way in that space. So that's really exciting, because we're building in all the things we've learned out of B22, working with health infrastructure and all the things that they've learned out of their building programs, and they do a lot of work in mental health. There's a lot of work we're doing in community living initiatives as well. So there's the PCLI program, which is about getting people into the community. That's well underway, and we're planning that work with the ministry as well. There's a lot of local work going on in Cumberland. We're not just waiting for the new build to come on, we're still doing a lot. So we just finished a major upgrade of all the Wi-Fi over there. There's a brand new duress system that's in over there. There's a whole host of work we're doing around how to make that place safe and keep it functioning. I mean, whilst yes, it's old buildings and needs a replacement, you know, it's still about people. So we still have to make sure that we don't lose focus and just talk about buildings, and we keep our focus on our patients. So a lot of work happening in their models of care. We'll try and bring on the new PEC early into Westmead, so that will help with our mental health cohort that comes through the emergency department. So still a lot happening. A huge amount of work in the models around how we're going to treat people and how we're going to relate. And I guess one of the greatest strengths of the new build as well is that because it's connected to Westmead, it allows that holistic care, you know, rather than the segregated, you know, mental health care in one building and acute care in another. When you bring them together, you get much greater strength, because, you know, mental health consumers have as many, you know, medical conditions as anyone else does, and so we need to make sure we have that good access and connectivity. So that's happening as well. So lots of really exciting stuff.
Very important work as well. It's nice to hear that the people are being put first, which is awesome. Question 4, talking about the future of health, virtual care is a huge area of potential, and we've only just touched the tip of the iceberg. So, Graham, you mentioned previously that over 45,000 people benefited from the in-touch model of care during COVID, and hundreds of residential aged care facilities have avoided ED admittance due to the model. What is this model of care, and what does the future of virtual care and the in-touch model look like for the Western Sydney Local Health District? Jasmine.
Thanks. It certainly is. So the in-touch COVID care and the community model was built during the Delta wave in Western Sydney, and it really was built off the skill set and innovation of the integrating community health teams in partnership with the acute facilities and specialist areas like the public health unit, healthcare interpreters, multicultural health, digital health solution had a huge part to play as well, and other areas of the district really leaned in to support us to build a model of care that supported the communities. To ensure that we could maintain the surge that happened during particularly the Delta, we also partnered with Calgary Medibank, who adopted our model of care. And as Graham said at the start, 45,000 people were cared for at home, so reduction in ED presentations, reduction in admissions, also enabled early discharges. And actually we also helped out some other local health districts, particularly Murrumbidgee Local Health District, to support them with the model as well, so they had less to have to care for in their own local health district. It was a great success. We do know we mapped the patient experience every week through My Experience Matters at that time. We know that we had a 91% satisfaction rate, and we also know that we had the best mortality rates across New South Wales, so we're pretty proud of the model. So, taking that experience from COVID care in the community, the In Touch team saw the next sort of area that they really could help the district with was in aged care facilities. So we developed a model to really look at avoiding unnecessary ED presentations for residential aged care facilities. We have 65 aged care facilities that sit in our remit in Western Sydney or in the geographical area. So we've been working with those, and over the last 3 months, every month, we've done approximately 90 ED avoidances by finding care for the patient in the residential aged care facility, bringing the care to them, or providing them a link to a care pathway that's outside the ED. We know that's better for the patients, it's a better experience for them and their family, and it also frees the emergency departments and New South Wales Ambulance to look after the patients that they need to. So that's sort of where we're going to into the future. That partnership with the aged care facility in New South Wales Ambulance is a really great start. So the future looks pretty bright for In Touch as we sort of adopt more models into the future. Our hospital and home is going through a huge expansion at the moment. We've got about 50 beds at the moment that we have in the home. We're trying to expand that to 100 in the next couple of months. We're also pushing out our virtual care, looking at more remote monitoring options as well, to really make sure that we monitor people safely and give patients the option of being cared for at home rather than sitting in a hospital if they don't need to.
Yeah, that's fantastic. It's such an important thing to think of, you know, when it comes to stuff like that. All right, on to our next question. Another area that's been reported on several times in the media this year is emergency department wait times. Graham, my submitted question for you is, emergency department treatment times at Westmead and Blacktown hospitals continue to be an area of concern we hear about in the media. Do you have the staff necessary to cope with the demand?
First of all, yeah, I share the concerns with everyone. I mean, emergency departments that's the really pointy end of the business for us. Where we are a big part of the community, and a lot of people come to us for care. So it is an area we need to focus on. Do we have enough staff? We've actually just invested a lot more in staff in the last 3 months, and we're in the process of recruiting. So there's been an additional, over and above what would be the calculated profile of what we should have, because there's a way of calculating that. We've added in an extra 15 registered nurses and 5 nurse practitioners at Blacktown Mount Druitt, another 20 registered nurses in Westmead. There are 2 major ones where we have our greatest challenges in throughput. We've added some more nurses into intensive care, because it's about not only just about the emergency department, it's about how you get them through. As Maria said, we're putting on a lot of new grads next year, so we've added a lot of nursing staff in for education, so to make sure that the new grads that come through are not just thrown in the deep end of the pool and see how well they swim. It's actually, we've got a few swimming instructors in there with them, a couple of floaties, and so it's about how do we make sure that we get them through that process. So do we have enough staff? Yeah, I think we do. I think there's plenty of staff in there at the moment. Well, we will have when we recruit them all. So we have a really active recruitment campaign going on at the moment, which I think is bearing quite a lot of fruit. We've had a lot of staff come on over the last 2 months, and as Maria mentioned, there's 300 plus that we're getting into the system this year. That will make a huge difference. But just the other piece I guess I'll put behind it is we're also investing in our senior consultants, because that's really where the biggest win for EDs are. I mean, they work really hard. They are amazing. If I look at what they did all the way through COVID, they were the absolute front line of our hospital, and they had everything coming to them, and they managed in a phenomenal environment. But the ED isn't the whole answer to the question, right? It's more so, in actual fact, what happens in the rest of the hospital. So we've invested quite significantly in new senior consultants, new doctors, to help through that process. Some in the emergency department, a lot scattered through the organisation. So Blacktown, Westmead, Auburn, all had investments in more senior positions to try and keep that throughput. So you can, it's like a glass. Once it's full, right? And you've got to actually empty some out before you can put some more in. So, you know, we are investing well in the ED, but you know, you've got to invest in the whole system, make it work. I mean, it's also what Hospital in the Home and the work that Jasmine's doing is about. It's about how do we get people home early, discharge early, give them an alternative to come in. So those 90 patients that didn't come to the emergency departments in the last 3 months, they're the ones that would have probably had a longer wait, because you know they may not. There may be other people in the waiting room that really need more urgent care. So you know we constantly juggle on the acuity of who's with us, who's on the ambulance, who's in the waiting room, to make sure who should we treat next. And so those 90 at home, it's a much better experience. It frees up the flow. Our performance since about July has improved significantly through the emergency department, our ability to offload ambulances, because really they need to be able to respond to the community, to triple O's, not to be sitting there with us. So you know, we've really pushed our ability and it's improved significantly. So yes, I think we've got good resources now. I mean, I'll always take more if anyone wanted to give me more, but I think, you know, I think we've got good support. We've got really good support through the government, through the ministry in our budget for this year to be able to increase that staffing profile. So now it's up to us to recruit them and get them into the room.
Great, it's very reassuring to hear that. As someone who has a partner who just spent some time in the emergency department, it's very topical for me as well.
Yeah, I hope we looked after them. Okay.
Absolutely, very much so. Now, I've got a question submitted for you, Belinda. Hello, welcome.
Thank you.
Belinda Cashman, our Acting District Director of Aboriginal Health Strategy. Now, the question I got for you, the Aboriginal Workforce Plan was launched in June, which is a great first step to highlighting the needs of Aboriginal staff and patients. But what else is the district committing to in this space?
We're committing quite a few things actually. So we're busy at the moment working with our corporate communications team to develop an Aboriginal communications strategy. It's been highlighted to us that we don't really have a strong internet and intranet system specifically dedicated to Aboriginal and Torres Strait Islander people. So we have partnered with a company at the moment. We're looking at the wireframe behind that and what it's actually going to look like. So we've committed to that, so that's underway. We're looking at developing our Aboriginal Health strategic plan for the LHD, and what that will actually encompass is, you know, very detailed from birth to adolescence, the whole family, elders, patient safety, formal partnerships with our NGO sectors, patient safety, safety for our staff. It will also look at how we generally do business internally, and also what our gaps are, and provide some direction across the LHD for Aboriginal and Torres Strait Islander health. We're also coming up in December, we've got our first Aboriginal staff conference, which is going to be great to highlight some of our you know, how we do business, and it's a good opportunity for Aboriginal staff to be consulted on the Aboriginal strategic plan. We're also in the business at the moment of looking at an Aboriginal Health Advisory Committee that myself and Graham and our board member will sit on, and that will consist of the NGO sector and their CEOs, and look at high-level business for the LHD. We're also developing an Aboriginal Consumer Council, and we're out for tender. We've been out for tender for that for quite some time. We want to get the right mix of people from the community. We will develop a reconciliation action plan out of that, and then provide the links all together. So we're actually really busy in that space. I don't think it just covers one thing. I think it covers many things, and it's a great opportunity to be a part of that.
Yeah, and it sounds like a lot of care and attention is being taken in those plans. Very exciting things to come.
Absolutely.
Now, our last question of the day is one that's been asked by a number of staff and community members, and this one, Belinda, is for you as well. In June, New South Wales Health Minister Brad Hazzard announced that a new dedicated palliative care unit will be built at Westmead Hospital. So a few things to cover here. When will the works begin? Are we getting a ward or a unit? And how many beds will there be?
I would love Belinda to answer that question.
I would love to be able to answer that question too. Don't think it's coming to me.
Probably.
Is that more of a you question? I think it is.
Yeah. But over to you, Belinda. No. So there are a couple of things in palliative. We're doing a lot of actually a lot of work in palliative care at the moment. So we're building a new purpose-built. It's almost finished. 10-bed unit at Auburn. That will be opened up. That's well underway. We are doing a lot of work in the community with PAL care spaces, and we've employed some additional positions. The specific one that you're asking about, that the Minister talked about for Westmead, is well underway under planning now. So in this year's budget, we've got all the planning money to do it. So it's in that design phase. The number of beds will come out of the design phase. They do a lot of work on how many people have accessed PAL care in the community and different areas. Look at it as a district level, so with beds at Westmead, beds at Auburn, beds at Mount Druitt, which is our phenomenal service at the moment. That will determine how many beds we put into it. So really, it'll be designed around what does the community need for that service, rather than how many beds can we afford. But so certainly in the budget this year is all that planning money, health infrastructure doing that work with us right now. I'm hoping that we will get that in the next few months, that we'll have a really good indication of what that looks like. It won't be an internal set of beds in another ward. It won't be part of another ward. It'll be a separate freestanding unit that will be dedicated to palliative care, which I think is really important. That's what the community is expecting. That's what the report said we needed to do. So we will happily do that. So it's just fine-tuning now the numbers game around what does the demand look like, and how do they calculate that into the number of beds that you need, and the number will come out of that work with health infrastructure, and then we go back to government and tell them how much they need to spend.
Great.
And then they make that commitment, and then we move forward with it.
Excellent. Belinda, are you happy with that answer?
I am very happy. Did you miss anything? We got some extra Aboriginal positions in there though, so we're growing that workforce.
Excellent. Well, one of the things we're doing, actually, talk about Aboriginal positions, is we're actually going to start mandating that whenever we grow a workforce, there has to be a component of Aboriginal workforce in it.
Good.
Rather than trying to let it happen organically, we're actually going to drive it, because I think it's important that we make a deliberate decision and take a definitive position that says, this is a critical part of who we are, and we need to make sure that we build it into our workshop. And we'll do the same in other areas like disability inclusion plans and those sorts of things as well. But this is where we'll start.
Great.
So when we do big recruitment, and we've done it for mums and bubs, that's the other one I didn't mention about mental health. It's a new mums and bubs unit opening up in this financial year. In mental health services, we've said the same there, that we want to make sure that we're including Aboriginal staff in that, so we actually start to have a breadth of employment across our organisation.
That's fantastic. Well, that is all the questions that we have time to answer today. Thank you so much to our panel and for your participation and providing insights into these issues and successes across the district in 2022. I am now going to pass back over to Graham to provide his closing remarks before we officially end today's forum. Thank you, Graham.
All right, thanks, Justin. Look, first of all, can I start by putting a few thank yous out there. It's been a huge year, so to all of our staff, for what you have done every day to come to work, to put yourself out there in an area where we were all worried. We were designing as we were going along. We were building the plane as we were flying it, because we had to, because that was the pandemic. But every day you showed up, every day you came and you cared for each other and you cared for your patients, and you went well above and beyond anything that you would ever expect or would have to do. And yeah, I know it was a 1 in 100 year pandemic, but that doesn't define our response. What defines our response is our staff. So that has been an absolute phenomenal effort, and an absolute thank you to every single staff member. It's been a roller coaster, that's for sure. We've had really, really good support. Can I thank the district executive and the general managers? The leadership team is really important in this space. In some ways, they're a little bit of an unsung heroes because, you know, we talk about the nurses and the doctors who deserve all the recognition and accolades that they get. But, you know, the executive that were there 7 days a week, 12, 14 hours a day, trying to make sure that we can create an environment where we can provide care. I really want to recognise that from that group because I think it's really important. And from everyone who's contributed, you know, our board, we saw Loretta earlier in the piece, you know, we're really lucky we've got a supportive board that's there with us and comes on the journey. You know, push us when we need to push, support us when we need that support, and help us to celebrate things that are going well and showcase. So, you know, we're really lucky that we've got that relationship. But I guess the other thing, just quickly, and some recognition, that it's nice to see recognition on the back of what, you know, have been a tough couple of years. You know, we've got, you know, 5 nominations in the Premier's Awards, which are coming up in the next week or so. We've got 3 nominations in the New South Wales Health Awards, which are coming up in the first week in December. We had one of our fantastic nurses nominated in the Nurses Awards that came through in the last couple of days. And I have to pick it up and read it because as of today, there was two awards from the Multicultural Health Communication Awards, Westmead Hospital Maternity Liaison Officer Nell McGallis, and the Women's and Newborns Health Multicultural Support Pages and Resources for Empowering Women, you know, both won Multicultural Health Awards today. So, you know, fantastic that there's some recognition out there, fantastic that people can see the contribution that everyone's made, and, you know, I feel absolutely privileged to be sitting in this chair, to be able to be part of what has been the frontline response to everything over the last 12 months. Just fills me with absolute energy and enthusiasm to get up every day and, you know, to see what we can do over the next 12 months. 22, 23 is really exciting. There is so much happening. You know, when we're here in 12 months' time having another conversation, there'll be so much to talk about. So thank you, everyone. Thank you, Justin, for coming along today. Thank you, everyone. It has been an absolute honour to be working with you, and I'm so impressed that, what the hell, I'll come back for another year.
That'd be lovely. We'd appreciate that. Thank you so much, Graham, and thank you to everyone for joining us on the 2022 Western Sydney Health Forum. Now, if we missed any of your questions today, I encourage you to forward them through to the email address wslhd-media@health.nsw.gov.au. A big thank you again to our panel for joining us. It's been lovely having you here today. And I'm going to leave you today with a highlight video of the 2022 Humans of the Hospital. Have a great afternoon.
It's part of my ethos and my philosophy in life, helping people.
I have the best job in the world. No 2 days are the same.
Do such a variety of treatment, you're really not limiting yourself, and you have the best patients in the world.
The best thing about nursing is the patients.
I'm doing it for my family, but even though it's hard work, I sacrifice everything just to support them.
I was always proud of this hospital because we wanted it to be a hospital that went to the people.
Loved my work here, loved it. Love the position, love the staff, love the executive.